Now, I just want to thank the HSE, Roisin, Philip, their entire team for putting in Trojan work to get the conference up and running. Much more work than you think goes into running a conference, so I just want to thank them first and foremost. And the conference is the HSE and the Climate and Health Alliance, and a lot of people are probably thinking, what is the Climate and Health Alliance? So I'm here today to talk about the Climate and Health Alliance, where we came from, our work. I am the Senior Policy Manager with the Irish Heart Foundation, but I also act as the Secretariat for the Climate and Health Alliance. A little bit of background first. We all know this. The understanding that human activity, the burning of fossil fuels, enhances the world's greenhouse gas effects was first established over 100 years ago. So that's well established. I'm not going to go through it. Our understanding and awareness of climate change is clear. So much so that in May 2019, the Oireachtas declared a climate and biodiversity emergency. Now, sadly, they don't always act like it's an emergency, but they declare that. But the problem is the health impact of climate change is too often overlooked, underestimated, and even unknown amongst the public. The public just don't even think that. When you think of climate change, you think of the emissions lens, the green lens, which is very important, but there's a huge public health impact that needs to be addressed. And a couple of years ago, the Irish Heart Foundation, Cancer Society, the RCSI, RCPI, a number of other kind of health bodies came together and thought how we can, lobby on behalf of climate change and health. So that was the basis and the foundation of the Climate and Health Alliance. And we are established with a clear goal, and that was to raise public and political awareness of the links between health and climate change, by firstly highlight the enormous public health harms that arise from climate change, and critically emphasize the significant health benefits that can be unlocked by tackling global warming. Because there's always a bit of a doom and gloom, but if we take action on climate change, we have all healthier lives. We have healthier lives for ourselves, for our grandparents, for our parents, for our grandchildren, and that's the huge driver of the Climate Health Alliance and why we were set up in the first place. We were established in late 2019, shortly after the Oireachtas declared that climate and biodiversity emergency, and we are an advocacy group. That's our first and foremost. We are a lobbying vehicle for change. We are an advocacy group that seeks to use our collective voice, our health voice, to advocate for fairer and faster climate action in the interest of public health. And this has been said a number of times. The importance of the health sector's voice in climate action cannot be overstated. We are trusted voices in society. That's doctors, nurses, pharmacists, household names like the Cancer Society, the Heart Foundation, the RCPI, National Women's Council. We have a number of organisations on board, which is great, and we're using our collective voice to demand change. And it's not just in Ireland that this is the case. There are similar climate and health alliances in the UK who we've done a bit of work with because they're much more further down the line of their organisation ability. There is a Australian Climate and Health Alliance who we've met again, who are doing great work. And there's even a global Climate and Health Alliance that we are members of. So this is a collective thing, using the health voice as a collective advocacy vehicle. The Irish Climate and Health Alliance, we have 27 members from around the island of Ireland. We are an all island body, so it's great to see BHFNI here. We have Stroke Association Northern Ireland. We have a number of other Northern Ireland members. But obviously the majority of the members are Republic of Ireland basis, so we're probably more focused on that front. But we are an all-island group, so we are very welcome to any group that's from the all-island. And we include health and social care professional organisations, NGOs, public health organisations, community groups, and advocacy groups. And the Alliance, as an advocacy coalition, is always open to new members who share our objectives of campaigning for greater, swifter, and fairer climate action. There's a few people who have come up to me today saying they want to join the Alliance, and we're always open to new members as long as they adhere to our principles, because the more voices, the better. Sometimes the more voices, it's kind of a slower in decision making, but it's better. The more voices in this, the better. And here are all our pretty logos all together. And when politicians see this at the end of a letter or in a statement, in a press release, they stand up and take notice, because these are household respected names. ICGP, UCC, School of Public Health, Cork Healthy Cities, UCD, School of Public Health, Children's Health Ireland, St. Patrick's Mental Health. I could name hundreds of them. Well, sorry, not hundreds. I could name 27 of them. So, but it makes a difference. And like that, we're always growing. I'm sure I've probably missed out a few logos here because I think every week or second week we have a new member, which is fantastic. So some of our work, we campaign across 5 key areas: air quality, active travel, sustainable diets, healthcare sector mitigation, and reversing the biodiversity crisis. So I'll go through some of the work we've done in the past. Some people are taking photos, so I'm never never know if it's rude to switch. Air quality. We are very active in the campaigning for the passing of the solid fuel regulations in 2022, an area that has a very big bone of contention in Ireland. We're all attached to our fireplaces, but the climate headlines, we're out there using our health voice, saying this is better for public health, countering the misinformation. That's what we were there for. We had a media campaign to raise awareness of the need for stricter regulations to improve air quality, and that resulted in the solid fuel regulations, which banned smoky coal and wet wood nationwide and restricting the marketing and distribution of turf. And we even have a working group to develop a position paper on air quality, and some of the members are here today as well. On active travel, we campaigned with other groups like the Dublin Commuter Coalition for the introduction of the Dublin City Transport Plan, which has already seen success in reducing private vehicle use. And again, we have a working group to establish a position paper on active travel. And in this photo here, it's the Active Travel Coalition group, which I believe it's the first time I met Roisin, and I think this is where that first got this ball rolling. So these kind of meetings, photo calls, they work because they get people talking to each other, and that's great because it leads to concrete action, it leads to concrete solidified lobbying. On sustainable diets, in May 2023, the Climate Healthlines held a conference on the topic of sustainable diets, which I'm sure some of you might have attended. And at that conference, we launched the Fixing Food Together report, which provided detailed recommendations of how Ireland could transition to a healthy and sustainable food system. A really contentious but important place where, important for health, but also important for emissions. A very grey area, it's not all black and white. So we have some of the copies of that Fixing Food Together report out in the main room, so if anyone would like to take up a copy, we'd be delighted to share them. And it's kind of a Bible of where Ireland needs to be in terms of sustainable diets. And we even presented the findings of the report to the Climate Change Advisory Council, so we're always lobbying on that front as well. And I'll let our next speaker is Anne Nolan from the ESRI, so I'll let her talk about this more. But we commissioned the ESRI to assess the health impacts of climate change in Ireland and the health benefits of addressing climate change in Ireland. And that was funded very kindly by the Cancer Society and the Heart Foundation on behalf of the Climate Healthlines. And again, Anna will go through that next, but the evidence was clear. Climate change will have a direct impact on the public health and the healthcare system in Ireland. And simply, Ireland is not immune to the impact of climate change. There's always that talk, we'll have warmer summers, but we're going to be really badly hit. So we need to act on it now and be prepared. And we are, as I said at the start, we are a lobbying tool for change. We are a lobbying vehicle for change. And ahead of the general election, we prepared a 6-page manifesto that was circulated to all parties. And again, a similar, more concise programme for government document will be prepared and circulated to parties after Friday when this programme for government negotiations. The election's Friday. We don't know what the outcome will be, but we know for sure that climate change may be further down the list, so we have to use our voice even more because the last time there was a general election, there was a green wave. That green wave is not here now, so it's kind of beholden on us all to kind of use our voice more and ask and demand recommendations in the next programme for government. And these are some of the recommendations that we had in our manifesto. Supporting energy poverty and accelerating the national retrofitting scheme, guaranteeing that 20% of the annual capital budget is allocated to walking and cycling, with the remaining 80% split 2-1 in favour of transport over roads. Introduce the remaining recommendations of the Citizens Assembly report on biodiversity. Introduce legislation to protect the public from unregulated junk food marketing. And Philip and Roisin might love this. Provide funding to the HSE Climate Action Division to facilitate the implementation of the HSE's climate action strategy. So money to actually get the job done. So that's where our voice is there for, and we'll be using our voice again after Friday. And again, while we're here today, we're working with the HSE with our joint declaration, and we're delighted to work with the HSE because that's how action gets done. We developed a joint declaration of action on planetary and human health, which was signed by over 30 organisations. And it's the early days of cooperation. There's still a lot of work to do, but we're delighted to work together, and we're going to make a difference. And I'll leave on a slightly kind of positive note. Collective action works. I've seen it with other alliances. A great example is looking at the tobacco control work in Ireland, the workplace smoking ban, the plain packaging, the Tobacco 21 legislation had just been passed. That was all through done alliances of NGOs and public health bodies. So collective action works, and it can work again for climate action. And the voice, as I said, of the CHA and other health bodies will be really critical in pushing for climate action in the next Dáil. So thank you very much. And these are the details if anyone would like to get in touch with the Climate and Health Alliance. Thank you.
Thank you, Mark. Our next speaker is Professor Anne Nolan, and Anne is a research professor at the ESRI here in Dublin and an adjunct professor in economics at TCD. Professor Nolan has a deep and profound understanding of the demographics of the Irish population, having worked with the Tilda study and also the Growing Up in Ireland study. So I'd like to invite her to the podium, please.
Good afternoon, everybody, and thank you so much to the HSE and the Climate and Health Alliance for the invitation to talk to you this afternoon. So I have to look this direction, don't I? So I'm going to talk to you today about a piece of work that we did at the ESRI. It was a collaboration between the health team that I work on and our climate teams, looking at the health impacts of climate change and the potential benefits and co-benefits of climate mitigation actions in Ireland. I'd like to thank Mark and his team at Climate Health Alliance, the Irish Heart Foundation, the Cancer Society for funding this research, and also to the EPA, who also supported some of the climate team that were working on this. So just to give you a bit of background, most people have spoken about this already, so I'll go through it very quickly. But we all know that climate change is a fundamental threat to human health. And I think it's interesting in the context, if you look back at sort of recent iterations of the global burden of disease studies, that it's only very recently that climate change kind of issues have become to the fore there. And they've only recently started to acknowledge, I suppose, the importance of temperature change in particular. And they are now included in their global assessments of risk factors for disease and mortality. We all know the statistics on climate change in Ireland. We are not immune, despite what we may think in terms of our sort of relatively moderate climate by international standards. And you know, the recent statistics from the EPA in terms of climate are particularly concerning. Again, we're all aware of the policy response, and I suppose it's been really interesting over the last hour or so to hear, I suppose, about the response across the health sector in terms of the actions that are being undertaken. But I suppose at a more broad level and at a policy level, it is important to point out that the EPA have noted that it will be a real challenge in trying to reach our 2030 goals, let alone our 2050 goals. But I think just taking a step back, I think it's important to try and understand and to delve a little bit more into the detail around how climate change may impact and is impacting health in Ireland at present, and what potential impacts our mitigation and adaptation measures might have for future health in Ireland. Ina has already mentioned, I suppose, some of the data challenges. So what I'm going to talk to you today about is one particular piece of work and research, and that's really been facilitated by really good data infrastructure in terms of the hospital system. If I had time, I could go into, I suppose, some of the challenges in terms of other aspects of the healthcare system in terms of recording instances of climate change-related health impacts. So what we did in this piece of research was, first of all, I suppose, just scope out the framework within which we were operating and within which we were thinking about these issues. So what are the pathways by which climate change impacts health in Ireland and is impacting health? We needed data to input into our modelling in terms of projections for future temperature change in Ireland. And then thirdly, I suppose the real meat of this research was looking at the association between temperature change and emergency inpatient hospitalisations. And we focused on emergency inpatient hospitalisations primarily because of the data infrastructure. It was good and it was well set up for us to look at this particular issue. And then finally, we scoped out the potential benefits and co-benefits of climate change mitigation actions in Ireland. So I'll run through each of these very, very quickly. So Ina actually has set this out really well earlier. So she sort of talked about, exposure, hazards, and the various vulnerabilities in terms of particular population groups. But I suppose if you look at the literature here, and if you look at the broader sort of international context, you'll see that there's really complex pathways linking climate change and health. And that is because of a number of sort of different complexities and dimensions that we're thinking about when we talk about this relationship. So first of all is the variety of events that could occur. We can think about increased temperatures, we can think about flooding or wildfires or more extreme events. And these can all have, different impacts on health. We can also think about whether the pathways are direct or indirect. So what I mean there is that they're mediated by other factors, and I'll talk about that in a second. And then you can think about the variety of health outcomes that can be impacted. So whether you're thinking about mortality, the sort of indicator as health economists we tend to look at because it's well recorded, other things like specific diseases or morbidity. And if you think about this in the context of sort of temperature change, you can think about, the sort of the direct effects. This is where my eyesight is going to run into problems. So, there's heat-related stress and sort of direct physiological effects on the body. But then increased temperature works through other pathways. So, it affects our air quality and respiratory health. It affects our water systems and affects infectious diseases, for example. And this all operates within the context of a sort of a broader social and economic system that either protects or hinders people in terms of their response to these stressors. In terms of temperature protections, I'm really not going to spend any time on this because everybody knows this, and this was really a sort of an input into the research that we were doing. But based on work that's been done by the Irish Centre for High-End Computing, we have a reasonably good understanding of what's coming down the tracks for us in terms of temperature change, and it's very concerning. They've also done some more updated work where they've looked at sort of more regional impacts, which I think is really interesting and that we could potentially incorporate into future iterations. They've also done some nice work as well in terms of trying to project the projected number of heatwave events that we might see by the mid-century. And you can see here that under different sort of climate temperature scenarios, so RCP 8.5 is where we do absolutely nothing in terms of mitigation, we could have between 3 and 15 events over that 20-year period, which is really quite concerning. So the third part of the research then was looking at what has been the impact of temperature change on emergency inpatient hospitalisations in Ireland. And to do this, we merged data from Met Éireann with HYPE, the Hospital Inpatient Inquiry System, over the period 2015 to 2019. So we stopped before COVID for obvious reasons here. And we have a database at a county, week and year level. And we focused on 5 broad diagnostic groups: respiratory disease, circulatory, metabolic diseases, infections, and injuries. I think, with reflection, we should have gone back to the HYPE data and asked for further diagnostic codes. There's been good evidence, I think, coming out of other studies, for example, of mental health impacts. But we looked at these 5 broad diagnostic groups. And essentially what we found was relative to the sort of the most common temperature bin in Ireland, which is around 10 to 13 degrees, there's a broadly linear increase in emergency inpatient hospitalisations for temperatures above 16 degrees. So you can see that there in the chart. Interestingly, we found a non-statistically significant effect for emergency inpatient hospitalisations for temperatures above 25 degrees. The caveat here is, thankfully, over this period, we had very few days, actually, that were above that temperature. So the statistical significance of these is really just wide confidence intervals. It's also potentially suggestive of maybe adaptation behaviours on the part of individuals if there are alerts, for example, put out. We observed this sort of pattern for all diagnostic groups. And interestingly, we found stronger effects for children, so when we looked disaggregated by age groups. And then finally, we looked at the potential benefits and sort of scoped out the potential benefits and co-benefits of climate change mitigation actions. So we all know the detail around the climate mitigation actions that are set out in our climate action plans. And I suppose it's useful to think about them in a couple of different dimensions. So obviously, if you think about the reduced emissions and the reduced sort of direct impacts of climate change, they will have direct impacts on our health. But the mitigation actions themselves, and many of those actions that Mark has been talking about in terms of more sustainable diets, more sustainable travel, decarbonising home heating, for example, they'll have broader impacts on health and well-being over and above the sort of impacts of those mitigation actions alone. And what we've done here is, I suppose, just illustrated the scale and, I suppose, the scope of the potential benefits that could accrue from different sort of combinations of actions that are linked to these RCP scenarios. So this is data from the COACH EU project. It was the Horizon EU project. And this is data for Ireland, which is sort of setting out under different RCP, so temperature scenarios over the rest of this century, so up to the end of the 21st century, what's the potential impact on annual mortality, so excess mortality due to heat. And what they show is that by the end of the 20th century, annual deaths could range from 216 excess deaths per annum under RCP 2.6, which is essentially equivalent to the Paris Agreement commitments, to just under 1,400 per annum under RCP 8.5, which is we're doing nothing, the known mitigation scenario. So I suppose that just gives you a sense of the range and the potential that is there if we meet our climate goals. So finally then, in terms of discussion or potential points for discussion afterwards, if there was questions, was I suppose it's important to note, and as a researcher, this is something that I suppose we are thinking about in terms of future research, is the complexity of these potential impacts and actual impacts of climate change on health. So I think what we have done is very narrowly focused on temperature change. There are obviously lots of other impacts of climate change in Ireland that are important to consider, and I know there's some research in other institutions, for example, looking at the impact of flooding, which I think is really important to consider, but also sort of broader sets of health impacts. Ina mentioned the sort of data infrastructure. I suppose we have relatively little visibility here about what happens in general practice in terms of medications, in terms of other aspects of morbidity, which I think would be really important to try and capture. I think the findings of increased emergency inpatient hospitalizations from higher temperatures underscore the potential impacts of climate change on the health sector, and I think we've heard really positive sort of talks this morning on steps that have been taken to sort of mitigate the impact. But I think they also highlight the importance of adaptation as well as mitigation actions, and Ina spoke about that. I suppose I haven't really mentioned the distributional sort of impacts of these impacts of climate change, other than we did a bit of disaggregation by the age of people presenting at emergency inpatient hospitalizations. But we do know that the health risks associated with climate change are more pronounced for vulnerable groups. And climate change undermines the social and economic conditions that promote good health. So I think a renewed emphasis on the sort of distributional impacts for future research would be really valuable. And I suppose to end on a positive note, reductions in greenhouse gas emissions and associated mitigation actions can have benefits and co-benefits for human health. And I suppose the scenarios that I've set out in the previous slide illustrate the potential range and the potential that we have. So, for example, implementing actions that are consistent with the Paris Agreement could save nearly 1,200 deaths per annum by 2100 compared to a no-action scenario. So finally, again, I would really like to acknowledge the Irish Cancer Society, Heart Foundation and Climate Health Alliance and EPA for funding to support this research. Also to Met Éireann and to the HSE Healthcare Pricing Office for providing the data that underpinned this analysis. And the full publication is available on the SRI website, and please do contact me if people would like to talk more about it.
Thank you very much. So our last speaker of this morning's session is Dr. Nora Campbell, and Dr. Campbell is an associate professor of critical marketing at the TCD School of Business, and her research focuses in the area of climate health and food economics. So I'd like to invite you to the podium, please.
oh my God, am I like a walking sandwich? Does everyone just see? Yeah, I'm everyone I know. So my promise to you is to save you 5 minutes and to give this presentation within 10, and I'll keep very much to script. So firms today are on a mission to be socially and ecologically responsible. They've squared the circle. They can, in the famous phrase, do well by doing good. But as my colleagues in St. Gallen have shown, there's a profound disconnect between their commitments, which have been reaching fever pitch in the last 20 years, and the macro-level deterioration of the planet and human health in the same period. This disconnect is vital to understand. So I've been an associate professor of business research and corporate strategy for the last 20 years, and I'd like to just tell you 5 things that I've found out. First, brands today don't compete so much for the best product features or even the best brand aesthetic, but they compete in the marketplace for virtue. Owning morality is the primary brand differentiation strategy today. These moralities are hotly fought over: climate activism, women's rights, children's rights. Secondly, firms are neither good nor bad. I've come to see them more like Janus, the Roman god with 2 faces that gives with one hand and takes with another, often and mostly unbeknownst to themselves. If this is actually the case, how would I be in a position to determine the inner workings of a CEO's morality? On what possible grounds could I question the value system of a commercial entity when it's doing its best to address the climate and health emergencies? In this era of corporate social responsibility, we are forced to explain our devotion or disdain to a commercial entity by almost having to talk in religious terms about their intentions and motivations, what I call an economic theology. Third, we need to move beyond economic theology and be rational. And here I mean the root of rational. We need to think in ratios. By this, I mean we keep seeing the works of corporate entities and industries as standalone acts of goodness. But what we need to do is see the giving of one hand and the taking away with another and measure the difference between the two. How much does Kellogg's fund cool camps in comparison to its branding budget of Cocoa Pops? How much does Guinness get in taxpayer subsidies to invest in its new sustainable brewing facilities in Kildare in the name of climate action? Where is the deepest profit pool in Ireland's food chain? Is it with its activity of farming, fertilising, flavouring or retailing? Fourth, people working in fossil fuel, alcohol, junk food, etc. don't wake up in the morning and say, I can't wait to make another child overweight, another middle-aged woman dependent on daily wine drinking, another lake into a dead zone. What we have is not greenwashing, but a much more difficult to dislodge activity, green wishing. Imagining that the CSR or corporate social responsibility actions are enough to slingshot us out of the problem or to compensate for the hand within our institutions that takes away. Fifth, faced with the profound disconnect between micro-level industry corporate social responsibility and macro-level indicators, health and climate research is entering a paradigm shift. And by a paradigm shift, I mean especially in knowledge production and a worldview where our tacit assumptions, our starting points for problem analysis and our units of measurement seem no longer tenable because they've either failed to capture reality or provide interventions that change that reality. So the starting point of overconsumption is incorrect. Since the Second World War, there's been an exponential increase in what is called production capacity, including exponential increases in research and development, technology and supply chain. This leads to overcapacity. So the overproduction problem needs consumption to solve it. Think of the global alcohol industry with its revenue of $1.17 trillion in 2022. So to put that in context, Conor O'Rahilly today is telling us why we can't have a funds transfer of just over that amount to the global south to mitigate a climate catastrophe. Or to put it in another context, that's more than the GDP of 179 countries combined. But Ireland predominantly creates public policies that place high burdens on individuals. Educate yourself, take responsibility for your behaviour, protect your children, read this label. Health is pressing on the wrong button. The paradigm shift has been called the commercial determinants of health, which means examining the pathways between commercial activities and the health of the planet and population. In March 2023, a Lancet series codified and officially systematised this research. It found that just 4 industries, alcohol, tobacco, fossil fuel and ultra-processed food, account for at least 1/3 of all deaths annually. One of the papers in this series is especially interesting to me because it visualises the different commercial activities that firms engage in, its labour practices, supply chain, marketing, reputation management, corporate political activity and science. We cannot permit organisations to decide which one of these aspects of its activities are moral, but we can only evaluate the intentions of a commercial entity for what it does across all of these dimensions. For example, does the entity fund scientific research? Meta-research, which is research into research, shows us that industry-funded science in nutrition, fossil fuel, alcohol and tobacco lead to findings that are favourable to the economic goals of those industries much more often than publicly funded science. Our experience in Ireland suggests that we often have quite a one-dimensional view of corporate political activity. This one here, sorry, and this is George Lima and Sandro Galea. So a one-dimensional view where power over decision-making and control over the political agenda. So, you know, the CEO of Ryanair, Michael O'Leary, met Pascal O'Donoghue last year at a dinner in a restaurant that wasn't declared in the lobbying register. That's level 1 of power. We need to move to understand 2- and 3-dimensional views of power in this country and beyond. Ryanair funds sustainable aviation research in my institution, where its sole focus of this research is on scaling up biofuel, not research into alternative forms of travel or degrowing the aviation industry. So to finish, I'd like to make 3 quick remarks. The first is never forget that corporations operate under a profound originary constraint, the need to deliver financial return on investment to shareholders. This is not the fault of bad actors within the organisation. It's the legal structure of the organisation. It is not a question of morality. Thus, taking a systems approach means refusing the economic theology of corporations, but situating discussion and action in the layer above, and understanding the incentives and the disincentives that they respond to. So again, another rugby analogy, but my colleague Francis Finucane, who I work with in Galway, says, go after the ball, not the player. It's only at this level of incentive and disincentive that we can stop being distracted and stop being busy fools with small changes to jolly them into action. So what are these incentives and disincentives? Well, it's not rocket science. You'd be glad to know it's only 3 things. Corporations respond to changes in taxes and subsidies, changes in accessibility, and changes in conflict of interest protocols where they are less regarded as partners in co-solving problems, but as rightful and necessary commercial entities that work within a strong regulatory environment. So to conclude, the commercial determinants of health tracks the commercial vectors, not the biological vectors of disease in all its forms. My colleague once told me that she sees it as the work of weeding rather than the work of sowing. There's an urgent need to do this clearing work, to teach it, to research it, to insist upon it in our discussions with policymakers. And not to hold commercial actors to a higher standard. No, just to a different standard. That's it. Thank you.